And it's September 11th, 2025. We're going to be broadcasting live spine surgery from Deuk Spine Institute. But first, we're going to do a moment of silence to remember the horrible tragedy of 9/11 24 years ago, when terrorists, radicals who wanted to impose their beliefs on everyone else decided to murder thousands of Americans and international people who were in New York at the time. And they flew two jumbo jets into the World Trade Center towers and destroyed them and killed so many people and changed our country forever. We'll never forget. So we'll take a moment of silence. Meanwhile, I'll get started. All right, we're going to get started, and I'm going to start with placing the needles. This patient is having bilateral L4-5 Deuk laser disc repair, along with, left 3-4, right 2-3. All right, let's get started at 4-5 shot. If you have questions, feel free to ask me, folks. I'm going to start a little higher. This patient comes to us from Michigan. He's had pain in his back for 25 long years, suffering years with back pain. And found out about the Deuk Spine Institute, came down here with his lovely wife to have the Deuk laser disc repair. He also has piriformis syndrome, so we're going to fix the piriformis muscles later on. But we're going to start by fixing these 4 discs. He is asleep. He is on propofol. We use twilight sedation. You can see the abnormal facet joints here at 4-5 shot. He has a little bit of spondylolisthesis. Everybody sees the slippage of one bone on the other shot. I'm just trying to navigate around this gigantic abnormal facet. I'm just feeling lots and lots of bone shot. So I'm going to have to try to come a little bit more lateral, which is okay. There's a safe area of laterality that you can go to get to the disc. You don't want to go beyond that safe area of laterality, because then you can end up in the abdomen, which you don't want to be in the abdomen. Shot. And just about there. Yeah. How's he doing? Good, Sean? All right. Just about there. And yep, that's perfect. Perfect, Sean. If you have questions, feel free to ask. In the meantime, while we're placing these needles, and I'm going to tell you right now, this guy has literally the biggest herniation I've ever seen in at least the last 10 years at L4-5 on the left side. That's where I'm starting on. It is massive. I told them we're not going to get all of it. You can actually see some of it. It's starting to calcify a bit. I'm not in yet. Shot. Let's get an AP. We're doing bilateral 4-5, right?
Yes, sir.
Everyone agrees. Shot. Lateral. Excellent. Henry, why don't we start with the 30 different causes of chronic back pain?
Of course.
I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majan. Thanks for joining us. John, welcome back. AP, we are almost finished with the first step of the surgery, which is always to place needles into the spine through the holes on the side of the spine called the foramen, the neuroforamen. And the neuroforamen is a natural opening on the side of the spine. You can see this patient from Michigan has already had spine surgery. You guys see the scar right here, the white scar?
Yes, we do.
So I'm going to just mark the scar for you. That was from his discectomy procedure, which did not work. I keep telling you guys, don't do discectomy. Doesn't work. Bad surgery. Anyway, you can see from the video you just watched that the most common cause of back pain is disc herniation, disc injury. We call it disc injury. The reason we call it disc injury and not just disc herniation is because the truth is it doesn't matter if it's a herniation, a bulge, a slip disc, a ruptured disc, a protruded disc, an extruded disc, a degenerated disc, a spondylitic disc. It doesn't matter what you call it. They're all the same. They all cause pain the same way, through inflammation in the tear in the back of the disc. I'm going to show you a video in a moment that will cover that, but for right now, I want to talk a little bit more about the video you just watched, and so you can understand a little bit more about it. We did an analysis of 5,000 patients with chronic back pain, and those patients had different causes of back pain. As a matter of fact, most every cause of back pain was represented in those patients. And we found that the most common cause of back pain, the primary cause, the number one cause, most of their pain in their back came from one thing, and that was the disc. 85%, it was actually truly 87%, but we just make it simple at 85, was disc as the source of back pain. About 9% was facet, joint, arthritis. And then the rest, let's just say it was about 5% that was piriformis or sacroiliac joint, and fractures, tumors, and infections. Is he awake?
How are you doing, my friend? You okay?
So we've lost a few drops of blood, probably 5 drops of blood.
He's awake.
All right. And remember, he's got back pain. When I asked him, where is your back pain, he basically told me this area right here. Deep inside, consistent with these discs at L4-5, L3-4, and L2-3. Are you having any pain? Any pain? None. Good. No pain right now, right? The other place he has pain, folks, is the piriformis muscles. And he has a tear in both piriformis muscles. These are muscles that connect the tailbone over to the hip. How bad is that pain on a scale of 1 to 10? 10? 10? 7. 7. The highest it went was what?
10.
10. All right, so we just tested L4-5. It was a 10, and we always record the highest, not the middle, not the average, not the lowest. We record the highest. It's a 10. Is that where you get back pain? Yes. So he said, yeah. So it's concordant. Concordant means that's where he gets back pain. So L4-5 is a 10 out of 10, concordant. Is it better now?
Feeling better?
Is the pain still there? Did you go back to sleep?
Is it feeling better now? He said
Yeah,
yes.
all right. Any pain?
No.
How bad is that on a scale of 1 to 10? How high does it go? 10. He said 10. I don't know if you heard that, Emmy, but is that where you get back pain?
Yes.
All right, my friend. Both of those are going to be gone when you wake up. Isn't that wonderful? Should we stop there? No? Did you hear that, Henry?
I heard that, yes.
How bad was that on a scale of 1 to 10? 11. Well, that was L2-3. It was an 11 out of 10, not a common disc. Is that where you get your back pain? All right, so if we were playing baseball, we'd be batting 1,000. We'd be batting 1,000. We're 100%. We're right on all 3 discs causing his back pain. He is 11 out of 10 at L2-3, 10 out of 10 at L3-4, 10 out of 10 L4-5. Thank you, yeah. So we confirm the discs are indeed the primary cause of his back pain. We're going to go fix him now. Henry, let's show the audience, how is it that a herniated disc or bulging disc or a degenerated disc can actually cause back pain? How does that happen?
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. You can see from our video that the disc will cause pain through something called inflammation. Inflammation is your body's trying to repair something that's damaged. So you send in your inflammatory system to, number one, clean up the mess, and number two, repair it. Clean up, repair. You guys got it? Clean up, repair. So how do you clean up something? Well, first you send in these things called neutrophils. Neutrophils are cells that contain toxic enzymes that basically digest proteins, fats, and carbohydrates, which is what every organic life form is made out of, right? So if you think about it, your inflammatory system is your body's defense system, very primitive, to go in and protect you from an invasion by bacteria, fungus, and protozoans, right? So foreign invaders. So your inflammatory system is, I hate to say this, but it's like the army, okay? I hope I don't get in trouble for this. But it's like the army. You send the army in, or the Marines. Send them in first. They go in, finish fighting, they do all the warfare, they kill the bad guys, and then once that's done, you send in the, used to be the Army Corps of Engineers, and now it's, what do you call it, private contractors that go in and rebuild. They rebuild everything, build all the buildings again, build libraries, hospitals, houses, restaurants, all that kind of stuff. So you got two phases. You got destruction and you got rebuilding. Now, the inflammatory system is capable of doing both, but it's mostly the destructive side, the military side. All right, let's pull out. Oh, there's a piece of herniation right there. Look at that. That's not a giant one, but it's a nice chunk. So the inflammatory system sends in neutrophils and macrophage. They go in and destroy everything. It's like taking a flamethrower and just burning everything you can. Trying to destroy. And then when they're done destroying, which usually takes about a week or so, then they're done, they leave, and the macrophages eat up, clean up everything. They're like the bulldozers and scrape all the broken buildings down and they pile them up in a big heap. That's what the macrophages do. They eat up all the debris and then carry it away to your spleen and liver where it gets metabolized, right? Broken down. All right? Safely. So they basically take all that waste to a dump site where it gets processed. Now, after the macrophages and neutrophils leave, the fibroblasts come in and start rebuilding with scar tissue, or also known as collagen. Now, it turns out that the annulus, which is torn, is made out of collagen. So when you bring in your fibroblasts to make collagen or scar tissue, it actually seals up the annular tear with exactly what it's made from, which is collagen, elastin. There's about, 16 types of collagen now, maybe 20. When I was in medical school, there was probably about 4 or 5. But now they've discovered more types of collagen. Either that or somebody needed to write a paper. long story short, collagen, elastin are what the annulus fibrosus is made from. So your body will reseal your disc with collagen and elastin made by fibroblasts that come there as part of this inflammatory response. But here's the problem. When you have a herniation, that nucleus pulposus that's coming out of the center of your disc, it gets stuck in the annular wall, it triggers the inflammatory response, and your body tries to remove it like a foreign invader. But the problem is it cannot remove it. It cannot remove it. Cannot remove the herniation. Because that stuff is indestructible. It is literally indestructible. So instead of removing it, your body just attacks it. And instead of the Army and the Marines leaving after a week, they sit there and they engage in warfare for years and years and years. And that whole time that they're attacking the herniation for years and years and years, like this guy, 25 years, right?
Yes.
They've been attacking that herniation for 25 years, causing back pain. So the attacking of the herniation by your body's inflammatory system produces inflammation, which you guys know from zits on your face. They are painful, they're red, they're swollen, they're tender, they're hot. That is exactly what we got here. A zit situation minus the bacteria or pus. I mean, you still have pus, which is the white cells, but you don't have the bacteria. We're not dealing with an infection of the disc, we're dealing with an inflammatory process like an infection, but instead of bacteria triggering it, it is the herniated nucleus pulposus. Now, who figured this out? I did. I figured it out. I put it all together about 20 years ago, and I've been trying to teach other doctors about it, but they don't listen. But I think eventually they'll get to where they understand this process, and we call it the pathophysiology of disease. Diseases cause symptoms and problems by something called the pathophysiology. And what it refers to is the mechanism by which they do. Okay, for example, in war, buildings get destroyed by mortar fire, by bullets, by rockets, by grenades. So the mechanism is artillery and gunpowder and projectiles and explosions. That's the pathophysiology of the destruction of buildings in a city, like in Ukraine by the Russians, unfortunately. Pathophysiology basically means the mechanism by which something happens. And it's disease that's happening, by the way, not something good. That's why it's patho. Pathos refers to disease, sickness, illness. All right. Any questions?
Yes, we have a couple questions and comments. This first question is coming from Thomas on YouTube.
Sure. After we take these questions, especially the first one from Thomas on YouTube, we're going to show you all, now that we showed you how these injured discs cause back pain, we're going to show you how this procedure you're watching right now is the best cure in the world for that back pain. And I've been trying to teach other doctors about it for literally 20 years, and they just don't want to hear it. And it's honestly arrogance and ignorance keeping them from listening. All right, Thomas, question, let's go for it. What do we got?
Asking, I have 2 bulging discs and soon to be your patient. How is that I cannot recall exactly when my bulges occurred?
Great question, Thomas. Thank you so much. Thomas asks a question that many, many, many people ask. Here's the answer. It's complicated, but just listen and you'll understand it. Remember, the sentinel event for all back pain and neck pain that comes from a disc injury is trauma to the disc. And specifically, what must happen is the annulus must tear, the posterior annular wall must tear, and the nucleus just inside that wall must be crushed into small fragments. We call it fragmentation. So trauma results in 2 things. Number 1, two things happening to the disc that you must remember. Number 1, annular tear, full thickness, all the way through. from middle inside to out. Number 2, a crushing of the nucleus pulposus, which is normally one solid piece of tissue, into fragments just inside the tear. Now, after that initial event of trauma, which is significant trauma, over your lifetime, just regular lifting, bending, twisting, sports, any kind of mild normal activity that would never cause an injury to your disc, what that does is it pushes out fragments of herniated nucleus, pushes it out, and those fragments get stuck inside the annular tear. The fragments that get stuck in the annular tear elicit inflammation. You got it? So when I get asked, I don't remember any kind of an event. That event, the original injury, could be 20, 30 years before you have any pain. Oh, we got a piece. I think it broke though. No, it broke. We had a good big piece. So the original trauma can happen 20, 30 years earlier for a patient, and they have 0 back pain, 0 neck pain until 20 years later. Okay? It's a fact, and that's very common. That's how it is for most people. Now, to give you an example, let's talk about traumatic joint injuries. I had one myself. I was a soccer player my whole life, and in high school I tore a thing in my hip called the labrum, anterior labrum, labral tear. Okay. Immediately I had pain that day, but it went away, and it stayed away for 30 years. 30 years. And then one day, 30 years later, when I was jogging, the pain came back. And man, it was so bad, and it's never left since then. So basically, the original injury can occur to a joint in your body many years ago, and you can go for many, many years without symptoms. Any symptoms at all. Have a normal life. And only until much later. Why is this sticking? Is this too bent? Many years later is when you start getting symptoms, okay? Very common. Same thing with disc. Disc is a joint, like your hip, your knee. You can injure it in an accident. You can kind of shake it off at the time. It doesn't bother you. And then 10 years later, because you injured the joint, you made it unstable, you have a capsule tear, there's inflammation happening in the capsule trying to heal. You keep re-tearing it and never give it a chance to heal all the way. What happens is it becomes weak and easily injured. Every time you do something like just go for a jog or whatever, you re-injure the capsule, you re-tear it, and you restart the inflammatory cycle until over time you get an ingrowth of small nerve fibers that are pain fibers. And those type 4 nerve fibers, those type class C fibers, pain fibers, they're unmyelinated, free nerve endings, and they become very, very excitable very easily with any type of pressure that basically activates them, and they send pain signals up to your brain. So it's the ingrowth of nerve fibers into the scar tissue that is responsible for that pain, and that takes many years to occur and many cycles of inflammation. All right, everything's going well. We got 4 areas to fix. This is the first of 4. This is the worst of the 4. This is the left L4-5. Let's go ahead and show our audience how it is that this laser can repair a disc and take away back pain.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
And welcome back. You can see from the video how we use a laser and an endoscope to repair the painful part of a disc, which is really the back of the disc where the posterior annular tear is. Do you have Grabzilla in case we need it? All right. So basically, the only surgery in the world, folks, the only treatment in the world that treats the source of pain in the disc, which is 87% of all back pain, is the Deuk laser disc repair. We have the only treatment in the world that actually treats the source of back and neck pain. That's because I figured it out 20 years ago, what's causing it, and I developed this treatment to treat it, and I've been trying to share it with other doctors around the world, but they just don't want to listen. They want to keep doing fusions and artificial discs because they pay better. It really comes down to payment. Money. The money that the surgeon makes. It's a shame that we don't have more doctors doing this treatment because it's so beneficial to patients. All right, this is where we're going to have the big herniation. Right there. You guys are seeing it. We've been chipping away at it, like kind of removing the base of a mountain, trying to bring the mountain down. So here is sort of that mountainous area, the base of the mountain. I'm eating into the base right here. As I do this, the mountain will start to sink down, and it's going to sink down right in front of us, so I can keep removing more and more of that mountain as it sinks down. If that makes sense. The top of the mountain is at the 12 o'clock position. 12 o'clock right there. All right, let's keep going. It's going to take me a while to do this, so let's take some questions.
This next question is coming from Lanu on YouTube.
Hi, Lanu,
Sa-
on YouTube.
Saying, I watched the movie K-Pax you recommended.
Good for you, Lanu.
Great movie, but the movie didn't get much attention because it was released weeks after September 11th. There are civilizations in space. Their medical technology are far superior in ours. It's sad that the government continues to keep it classified. Would you take a risk to visit K-Pax planet if they invited you?
Lanu, you're an interesting person. Yes, I would. I would now. Would I have when I was 25 years old? No. But I would now. Yes, I would.
And then the next question coming from Pavel on YouTube.
Hello, Pavel.
Saying, hi, Dr. Deuk. Have you done disc repair using only the grabber?
Yeah, you cannot do disc repair using only the grabber. It doesn't work. It would not be the Deuk laser disc repair. So it doesn't work. It just doesn't work. There's an old saying we have here, if it ain't broke, don't fix it. And I think it's an important saying. It's a very important saying. If you have something that works very well, it works perfect every time, why are you going to try to make it better? The only reason I would consider not using the laser is if I didn't have a laser. But I could tell you there's other doctors that do endoscopic transforaminal disc removal without the laser, and they don't have the results that we have. So I don't need to do what they're doing to find out it doesn't work, because it doesn't work for them. Why would it work? Why would it work for me? I'm not the first surgeon in the world to do this endoscopic surgery through the foramen. There has been many ahead of me, many, probably at least 20 or 30 ahead of me. I've been doing it for 20 years, but there were doctors doing it for 25 years, maybe even 30 years. And those doctors used just the grabbers, and they did not cure back pain. They only helped leg symptoms. So why would I adopt their technique when we know it doesn't work for back pain? That's like saying, Dr. Deuk, if you had a cobra removal business in India, you had to remove the king cobras from people's houses, would you try it with your eyes closed? No. I don't need to try it with my eyes closed to know that it's a bad idea. Right? Would you try to take a cobra out of someone's house with your eyes closed? I wouldn't. We know this works. Let's stay with it. Remember the old Trump saying? FAFO? Anybody know what that means?
Yes.
What does it mean? That's right. F around and find out. We're not going to F around with people's safety and health. I would do my cobra removing service eyes closed before I would, you got it? Before I would, oh man, that was a good one, huh? I would do my eyes closed, blindfolded cobra removing, hold it please, cobra removing service before I would put one of my patients' health at risk with stupidity. In other words, if you want to do stupid things, do it to yourself, don't do it to other people. Oh yeah, holy shit. That's a big piece of herniation. At least I grabbed it, but it's not coming out. So let's see if I can get some more. Any other questions?
Yes, we have a question coming from Lanu, once more on YouTube, asking, did this patient have a fusion? Just curious.
No, I don't think they had a fusion. They had a microdiscectomy. That's why they had that scar on their back. I showed it to you at the beginning. Remember, I'm against microdiscectomy. So this big piece of herniation that was here, you guys could see it on the MRI. I am trying to remove as much as I can, but it's coming out in small pieces, not big pieces. And that's okay. I'll take it any way I can get it. Any other questions?
Yes, we just got another question coming from Faisal on Facebook,
Faisal,
saying, Doctor, nice to see you again.
thanks.
As a neurosurgeon, was it more challenging removing tumors in the spine and brain than repairing discs and facet joint pain? Thank you.
Hey, great question. The answer is yes, for sure. It is more challenging surgically and after surgery to remove spinal cord tumors or spine tumors. Remember, there's there's different types of tumors in the spine, right? You have tumors of the bone, tumors of the spinal canal or dura, tumors of the nerve, Schwann cells. You have tumors of the meninges like meningioma. You have tumors of the supporting cells within the spinal cord like the glia, like glioblastoma or glioma or pilocytic astrocytoma. You have metastatic tumors. The most common tumors in the spine are metastatic tumors. They're breast cancer, lung cancer, prostate cancer, colon cancer, all those cancers that spread to the spine from other areas, right? Primary areas. Those are the most common types of tumors in the spine. Those are definitely harder to remove and stabilize and potentially reconstruct the spine, but I've done many of them in my career. It's not something I miss, and it's not common. Thank God. Thank God metastatic tumors to the spine are not common. Thank God we have less invasive ways to treat them than surgery, like radiation or chemo. So surgery is not always necessary for spine tumors. As a matter of fact, one of my best friends, Dr. Udi Mendel, he's at Johns Hopkins. He's the head of spine surgery for tumors of the spine. And that's his specialty. That's what he does. He's probably the best there is in the world at removing tumors from the spine. Dr. Ehud Mendel. He actually got me to come to Florida for my training. He was doing a neurosurgery spine fellowship with Dr. Richard Fessler. Dr. Mendel was at USC in Los Angeles with me. He was ahead of me. He was a neurosurgery resident that wanted to train in get extra training in spine. So he left USC, came to UF in Gainesville, trained with Dr. Richard Fessler, who's now in Chicago. And Udi went on to become one of the best spine tumor neurosurgeons in the world. And if I had a tumor in my spine, I would go to him. Great guy, technically gifted, just a wonderful person, one of my friends. He actually convinced me to come to Florida, University of Florida, for my training. I was going to go to the Barrow Neurological Institute or Seattle. I was looking at Seattle, I was looking at Phoenix, and I was looking at Florida as the top choice, or USC as the top choice. And as I've told you before, I was the #1 draft pick in the world for neurosurgery that year that I applied because of my grades, my accomplishments, my research, my achievements. So I could go anywhere I wanted to go. And Udi basically convinced me to come to UF. He said the chairman, Dr. Roten, really liked me and wanted me to go there. So he was very influential in my decision to go to UF and my choice to stay there. And now he's at Johns Hopkins. He's the head of spine surgery for tumors. Great guy. But I don't do tumors of the spine anymore. I could, if I had to, do tumors of the spine. I could do those surgeries, yes. But this is my specialty now. This is what I focus on. And I'm not so interested in picking up a new sub-discipline of spine surgery. All right, we are taking a lot of time on this particular disc because this is the biggest one. I want to make sure I take out as much herniation as I can to give the patient the best result possible. Any questions?
Yes, we have a couple more questions. Next one from Thomas, once more on YouTube, asking, is the herniated, quote, crab meat that you take out with the, quote, grabber a solidified form of the disc's previous liquid state?
So great question. And that was who again? Thomas?
Correct, Thomas.
Yeah, Thomas and everybody else. The disc is not liquid. I don't know why people think it is. This is what the normal nucleus looks like. It's a bit scarred up, so it's maybe a little firmer, but it is not a liquid gel. It is what we call a semi-solid. and it is not liquid. Never was liquid. Never has been liquid. It's just semi-solid. Now it does get firmer with all the scar tissue around it, but it's never a liquid. All right, we're almost done. I've basically come out of the disc. You guys can see the bone right there, the bone right there. We're outside the disc. That is the epidural space. And what I'm trying to do is now work my way back towards the spine, towards the herniation, taking out the base of the herniation. We call it a debulking. It's a very common procedure and used in spine, in any type of surgery, when you try to, lessen the mass effect of a tumor. Oh, look at that. So tumors are masses, and this herniation is a tumor. It's a mass, and it's a mass where it's not supposed to be. It's pushing on the nerves. So now I'm debulking this mass by removing as much of the herniation as I can. I'm going to bring in my grabber, and so far I don't think I need the Grabzilla. There's not much room to work with the Grabzilla, but this grabber right here may just be enough. There's a piece of herniation. Hold it. There it is. That's a nice one. So once again, I'm just debulking the herniation. Man, a lot of resistance, huh? Okay. Any other questions?
Yes, this next question from Lanu, once more on YouTube, asking, is there a connection between a herniated disc and a migraine headache?
Well, Lanu, that's a really good question. The short answer is no. A true migraine headache is a vasogenic event. It comes from vasomotor instability involving the little muscles around the arterioles, around the brain, and drugs like sumatriptan are quite effective at stabilizing this muscle and normalizing blood flow and reducing the headache. So a migraine does not come from a herniated disc. However, people do get headaches from herniated discs in their neck. Very common problem. Very common. All right, we're just about done here. I'm done basically at L4-5 on the left, and I'm going to move on to the left L3-4. So any other questions? Scope off?
Yes, this next one
Light on?
from Faisal, once more on Facebook,
All right, fine.
asking, thanks doctor, so would you advise me that for my 8th left rib benign tumor to have resection and open surgery to completely cut out the tumor fully rather than scraping it off and filling up the gap? Why? Thank you.
Yeah. So Faisal, let me understand. You've got an 8th rib benign tumor, and I believe, if I'm not mistaken, it's causing some pain, right? By the way, here's some herniation. You guys see this right here? Just a few pieces that are laying around. I just collected them. But you can see the nucleus is not a liquid. It's solid, like crab meat. That's what people say it looks like, the degenerated stuff. But getting back to your question, if you're having symptoms and pain from the tumor, I would have it resected. I would resect it. You're torquing it. You're twisting it. It's just got to be a straight pull. I would resect it personally. That's what I would do, because your symptoms will never go away. The only reason I would not resect the tumor is if you were like, 80 years old, and your life expectancy is just another few years. Then I would just treat it medically with medicine, maybe shots if you could into the area, periosteum. But if you're young and you have more than 10 years to live, then that tumor is going to continue to grow and cause pain for you. What I would do if I were you and I had me as a surgeon to do it, I would have me remove the tumor. Very easy to do. It will take me 30 minutes and the pain would be gone. All right. And there would be no side effects or complications as a result. But there's a lot of bad surgeons out there I wouldn't trust, and they can mess you up pretty bad if you trust them to do your surgery. I guess you know it's benign because the radiologist told you it was benign based on the CAT scan or imaging. The only way to know if a tumor is truly benign is to remove it or part of it and look at it with a microscope and do some tests. But assuming your tumor is benign, which it probably is, it's probably an osteoma or an osteoid osteoma or osteoblastoma. Those are very common. Could be it's not a meningioma, but it could be like a tumor from the covering around the bone, periosteoma. It's really an osteoma. All right. But again, I would, if it's causing symptoms like pain, I would have it removed surgically. Let me see. Yeah. All right. Any other questions?
At this moment, no current questions.
I love the fact that she watched K-Pax because it's like I go around and tell people things that they can do to help themselves get better. And most people don't listen, like my staff. They ignore me. But you listened. And I love people who listen. It shows a high level of intelligence. I do the same thing. I ask for advice and I usually do what the person tells me to do. But you have to have confidence in yourself, with that kind of situation. All right. So this disc, look at that inflammatory tissue, folks. This is L3-4. This was a 10 out of 10, right? Yes. Yeah. Yes. 10 out of 10 pain. Look at all that pink material. That is his inflammatory system attacking this area and creating what's called granulation tissue. Now, granulation tissue is what really hurts the most. It is novel. It's like early scar tissue. It's got lots of little painful nerve fibers in it. Okay, granulation tissue. Look it up. Granulation, Granulation tissue. And you'll see what granulation tissue is, and you'll see why it's painful. All right, any other questions?
No current questions, so we do have a comment coming from Faisal once more on Facebook, saying, following up on their question of their 8th left rib benign tumor, saying pain, breathing issues, and sometimes it's causing heart palpitations due to the location. It's growing inner. It's also my spine. It's causing my spine to curve. I know it's causing circulation issues and nerve pain. I had an X-ray, CT scan, and SPECT CT scan, and a thoracic MRI. And his oncologist department confirmed it's benign and it's slow growing and not invading any tissue. It's contained in the bone.
Yeah. All right. Well, there you have it. So, my God, that's a lot of inflammatory tissue right there. So there you have it. The problem is if you're in the United States getting your insurance to pay for that surgery, they don't want to pay for it. They're going to say it's benign. Just take medicine the rest of your life. But do you really want to take medicine the rest of your life while this tumor grows inside you, right? The answer is no. But the problem is insurance companies will then say, well, we're not paying for it. My God, Henry, look at all this inflammatory tissue. I don't think I've ever seen this much in one disc. This is a new record. Man, I've seen some interesting inflammatory tissue inside the annulus, but this thing is a new record. A new record. So I'm going to remove it all the way up to the end plate. That's the end plate there on the left. And there's the end plate on the right. The end plate is the surface of the bone above and below the disc. It's called the end plate. You got a good size degeneration and maybe even a big piece of herniation right there. I don't know what the hell. That thing is pretty degenerated. Beautiful. Look at all that inflammatory. I know this pain's going to be gone when he wakes up. I'm very happy for him. Look at all that. Look at that inflammatory tissue, guys. This is amazing. Have you ever seen that much? Nikki? Luis? So much. Pretty cool. It's gratifying. Yeah. All right, Henry, let's show our audience why this is the best surgery in the world when you have back pain. Hi, I'm Dr. Deuk Majan. We've just completed our free MRI review with Deuk Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint, or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically, people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Deuk Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk laser disc repair. We've been performing the Deuk laser disc repair since 2006 here at the Deuk Spine Institute. To date, we've had 0 complications. The Deuk laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. And welcome back. You can see from our video we just showed you guys that there are many types of spine surgery available in the world. They're all invasive procedures. They all involve cutting muscle, cutting ligaments, cutting your bones, normal muscle, normal ligament, normal bone to get to the spine. The Deuk laser disc repair doesn't cut any of your normal muscle, ligament, or bone. We dilate the muscle, ligament, and bone. Well, we don't dilate the bone. We dilate the muscle and ligament. We spread it apart and then put it back together when we're done. So there is no cutting. And on top of that, the other treatments don't actually get rid of your pain. They usually make it worse. So why do doctors do them? Well, money. They get paid. That's why. And they're allowed to do them as long as you are letting them do it. When you sign that consent form, you're giving them permission to use you to make money. Right? All right, I got another minute on this disc, Dr. Berndez, then we're going to go to the other side. Okay? But the truth is, those treatments that we showed you guys in that video, the invasive ones, they're now completely outdated and unnecessary and should be avoided at all costs. There's a word for that. You guys know what that word is? No?
Do not.
It starts with a... Antiquated is not it. Obsolete. Obsolete. That is the right word. Good job, Luis. Luis! English is not even your first language. Right? Is it? All right. You got it ahead of all the natural English speaking people. Obsolete. Obsolete. Look it up, folks. Google it. It means outdated, no longer good. All right. Pretty much, yeah, we're done here. Let me see. I don't see any more herniation. We got a lot of herniation out of here. Let me just see if there's anything more I can get. Everything else is pretty much stuck down and not coming out. So I think we're good. We're going to go to the other side. We got 2 discs to do on the opposite side. L2-3 and then again L4-5. Any questions?
Yes, we have a question coming from Thomas, once more on YouTube,
Hello, Thomas.
asking, nutritionally, taking collagen helps in building the disc repair then?
No, I don't think it does. I mean, look, I can't say with certainty, but I am about 98% sure. Here's why. Something a lot of people don't understand about human physiology, or animal physiology for that matter, is when you eat a protein, and collagen is a protein, your gut breaks that protein down with enzymes into the basic building blocks of all proteins, which are called amino acids. So you're going to break that collagen down into amino acids. And there are, I don't know, some 20, 21 amino acids that all proteins are made from. Every single protein in your body, every enzyme, everything that does work is made up of amino acids. And the amino acids are stuck together like a chain, like beads on a chain, to make proteins. Collagen is one of those proteins. And when you eat collagen, your gut, your intestine secretes, watch out, proteases. Proteases are enzymes that enter the center of your gut where the collagen that you ate is. And those proteases literally chop up that collagen molecule, protein, into tiny little single building blocks. So it's like going to Legoland. You guys know Legoland in Orlando? And looking at that giant Lego dragon made up of all those Lego and breaking it up into single little Legos. It's no longer the dragon. It's just a bunch of Lego pieces. And then you got to rebuild it, resynthesize it. And that's what your fibroblasts do. So eating collagen, in my opinion, is no different than eating any other good protein source, like eggs, which is the best protein to eat, eggs. They have virtually every amino acid you need. Eggs have always been considered the gold standard of protein consumption for humans and animals. A lot of animals eat eggs, right? Reminds me, when I had my Nile monitor. Remember I told you guys Tuesday about the Nile monitor? His name was Sal. That's what I named him. If you guys don't remember the story of Sal, there was, when I was at the University of Florida in Gainesville doing neurosurgery residency for 7 years, one of the fellows for Dr. Art Day, he was a cerebral vascular fellow, probably the top second, probably not number 1, but number 2 cerebrovascular fellowship in the world. The first being with Dr. Richard Spetzler. Spetzler was at the Barrow. He was probably the most famous cerebrovascular neurosurgeon of the 90s, 2000s. And there's others, but Spetzler was number 1. He was the best. He was basically for aneurysms and AVMs what I am for spine, for degenerative conditions. Okay? He was an innovator, a pioneer, and technically he was just perfect. I almost went to the Barrow for him. Long story short, Chris Kapashkin was a fellow training with Art Day, who is probably the second best cerebrovascular surgeon in the country. And I met him through the fellowship he was doing, and we hit it off. We both liked reptiles. We both played video games. And he was just a good person, good heart, good kind-hearted person, down to earth. He wasn't a narcissist like so many neurosurgeons. And he was diagnosed with cancer, testicular cancer. And basically was going to succumb to metastatic cancer. So he told me his dream was to have a large lizard, a monitor lizard, specifically a Komodo dragon. But that was both of our fantasy, was to have a Komodo dragon. But you can't have a Komodo dragon. It's illegal in America at the time. So he settled for the next biggest lizard, which is a Nile monitor. Long story short, his wife wouldn't allow him to have it. So I told him, listen, buy the lizard, take care of it while you're alive. When you die, have her send it to me and I'll take care of this lizard. And he did die, and his wife sent it to me. And my wife and I took care of this lizard for many years. The lizard's name was Sal. I named him Sal because of salvation. I always felt that he was Chris's salvation. It's the thing that Chris dreamed about in his life, to have was this giant lizard as a pet that he could take care of and live with and appreciate and look at and hold. And so it was his salvation. So I called this lizard Sal when I got him. So we took care of Sal for many years. And I told you all the story about how the landscape gardeners unplugged his heating pad and heating light in the middle of winter and he froze. But before they did that, I used to feed Sal what I fed all my reptiles, snakes, which is rodents, rats, frozen rats. So you can buy rats in bulk, 10 rats to a pack, put them in the freezer, keep them there until you're ready to feed them to the snake or lizard. And then when you are ready to feed, you take one of the rats out, you defrost it during the day. And what I used to do, I took a hair dryer and I would hair dry the rat so it warmed it up, because that makes it more appetizing for the lizard or snake. They would get their tongue flickering out, picking up those rat scents, smelling that hot rat body, and they loved it. They were in heaven. So I would do that for all my snakes and for Sal. So I would feed Sal one rat every week, keep him fit, trim, keep him on a good diet, ready for the reptile Olympics. And one day I read that these things, you take care of a pet like a lizard, right? And you're feeding him rats and you're thinking, this is what he must eat in nature. This is what he must eat in nature, rats. And then you realize there aren't that many rats in nature for these lizards to eat, because they live underground. So then you start thinking, well, what does this lizard eat? And one day I watched the Discovery Channel, and they were doing the Discovery Channel program on these giant lizards. And they were showing how the Nile monitor actually sneaks around looking for alligator eggs or crocodile eggs. So they actually hunt for eggs. They eat crocodile, alligator eggs or turtle eggs, whatever eggs they can find along the bank of the river. So I thought, I'm going to try eggs. So I took some chicken eggs, went out, and normally when I went out to feed Sal a rat, he would kind of just be laying there. He'd slowly pick his head up, flicker his tongue a few times, smell the rat, and kind of come over slowly to the door where I would go in and feed him the rat. And he would, eat the rat. But when I showed up with eggs in my hand, he saw it from 500 feet away and literally leapt off the ground and came right up to the gate, flickering his tongue like crazy, standing straight up and like trying to get to me before he even got to the cage. And I'm like, my God, this thing must know what these eggs are. And as soon as I opened that door, he wolfed those eggs down. I mean, wolfed them down. The one thing though is that when they bite it, it cracks and all the yolk and everything kind of leaks out. So I thought, he's, a lot of this is going on the floor and it's kind of wasted. But it is an egg and it only costs like, 25 cents back then. So I thought it's a lot cheaper and more convenient than rats. So I basically converted Sal to an egg-based diet. Remember we were talking about how eggs were the best source of protein? And I guess they're the natural diet of these reptiles as well, these water monitors. So that's my egg story. We have any questions?
No current questions, but we do have a comment coming from Lanu on YouTube once more,
Yeah.
saying K-Pax, the movie, reminds us humanity is so much needed today. People
Yes.
helping people. Watch this movie, everyone. I will, Lanu. I was going to watch it on Netflix tonight.
Yes. I'm so glad you got so much out of that movie, Lanu, because that's really what it's about, isn't it? He suffered a huge tragedy in his own life, and he ended up turning that horrible event into a very positive, he became a very positive influence on the other people's lives, which I won't say anymore because I don't want to ruin it. But wow, what an incredible story. They don't make movies like they did in the 80s anymore. Those movies were amazing. I could give you guys more movies to watch. I love movies. I actually started watching the Lara Croft movies again. Tomb Raider. Yeah. She's great. I like those movies. They're really well made.
They've been trying to reboot that franchise for the longest time. Like today.
You're not going to do better than Angelina Jolie.
Facts. Period.
Yeah. She was like the perfect person for that role.
Exactly.
I'm sorry, but she was perfect. The whole crew, the whole cast was just perfect. Even the villains, all the villains were perfect. They were so villainous,
Agreed.
so full of vile.
It was fun. And then with today, it's just not fun. It's just beating a dead horse, it feels like.
Yeah. Same thing with music. They've got all these remakes of great songs from the 80s,
Yeah.
Like you listen to Flock of Seagulls remakes, it's like, this is terrible. Yeah. Yeah.
Very, very true.
It's sad though because they're stealing the history of music. They're trying to become associated with that song and they want people to think of them as the ones who created that song. And their music sucks so bad. I know I'm going to get some hate mail for that one.
I agree. There's just a lot of people using loops from 80s and 90s music, even 70s, and it's just not...
1 minute on this one. I got one more to go.
Yeah, it's just sad.
Yeah, I mean, the 80s music was perfect.
Perfect.
And they're trying to make it theirs and change it and make it theirs, and this doesn't work. Right, Luis? One of the greatest bands of all time is one that Luis and I both love. Gypsy Kings. If you want great music, listen to the Gypsy Kings. The original Gypsy Kings. Songs like Bambolero, Caminando. Such good songs. Great music.
We have a question.
Sure.
Question for me, coming from Lanu on YouTube. saying, Henry, you are monitoring the screen. Is your screen color or black and white? It's color. Same screen. I'm using HP and a projector, all same color.
All right, folks, we've got this disc and one more, we're done. Then we're going to go on to the piriformis muscle. Our next patient is a patient who has cervical facet pain. We're going to be doing his surgery in room 2. You will not be able to see that because we don't have a recording or broadcasting system in that room. So we're gonna take about an hour break from you guys, and then come back and do a 1 level with a piriformis, 1 level DLDR with a piriformis, and maybe, just maybe, we have one more surgery at the end of the day, which will be a 3 level DLDR, 3 level lumbar. We'll see. Do we know if that's go or? Oh, okay. Sure. All right. Here we are, last bite. Now, let's see. If we come out of this disc, I guess there's a tiny bit there left I'm going to go get. Any other videos we can show our audience, Henry?
Let me check. We have shown essentially everything from discogenic, how to cure, 30 causes.
How about facet?
Let's talk about facets. I was just going to go there. Yeah.
Second most common cause of back pain.
Exactly.
Facet joints.
Let's show them how what causes facetogenic lower back pain and how it is that we cure it.
All right, and we're gonna, while you're watching that, we're gonna move from this disc to the next one.
For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
I used to buy my wife flowers, but they die after a week or two. You buy a plant, it keeps making flowers, as long as you take care of it. Is it alive? It's still alive. All right. All right, well, welcome back. We're just talking about what gifts we get our significant others. And I bought my wife some plants this year. Some beautiful white flowered plants that she wanted. Shot. What does everybody buy for their significant other on their birthday? Let's get some answers here. Let's break up the monotony. Birthday, anniversary, spa day.
I've done that before too. That's actually a good one. That's a good one.
Yeah, spa day is a good one. I've done that. All right. Any other people want to comment? How about our audience? Let's get some gift ideas from our audience.
Once they will comment, I will let you know.
How about a Deuk laser disc repair? Right? That'd be a great gift.
That's a great gift.
Was that him? Almost done. You're doing great. Last one, and then piriformis. I think he's happy with his anesthesia. What would you say? Berndes? Hold on. Uh-huh. All right, what are we doing with our audience at this point?
At this point, we
Okay.
have talked about facets. We have still awaiting comments on anniversary gifts. If they would like to comment on that. We can talk about either or of
A little
laminectomy
bit,
or
yeah.
microdiscectomy, and why people should avoid those at all times.
Yes, let's do that. Let's show people why you should avoid a discectomy.
A large incision is made. Muscles are torn from the spine. Substantial bleeding occurs due to muscle trauma. Normal, healthy bone is removed to access the herniation. Stabilizing ligaments are removed in order to access the herniation. An incomplete portion of the herniation is removed. Dense scar tissue forms. Weakened bones can fracture, leading to instability and pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right. Welcome back. Huh? Woo! All right, we're gonna fix this guy here. We got one more disc to fix, but you can see how collapsed the disc is. Little piece of herniation floating by. All right, let's go. Time to leave. I need to K-pack this piece of herniation. Get out of here. Any questions?
No current questions, but we do have a comment coming from Faisal, once more on Facebook,
All right, Faisal.
saying, Dr. Deuk, thank you so much for your advice. It means a lot. I now can go to my doctor and ask him to take it out. If he says pain management or scraping off surgery, then I will go somewhere else. By the way, I will come and see you for my neck next year. I will make sure you do all the levels that need addressing.
All right, Faisal. Not a problem, my friend. I just want you to have a good life. That's all. That's it. Having a good life means you want to be as pain-free as a human can be, and you don't want to have any complications from the treatment that you got. Unfortunately, so many doctors today create complications with their treatments, and they don't think anything about it. It doesn't matter to them that they hurt the patient and that the patient has to live with a complication the rest of their life. I do want to make a plug right now for our blog, the Deuk Spine Institute blog. We are creating new blog content, and if you go to our website, you'll look for our blogs. We have some really good articles that are being written by Margie, who is the head of our marketing department, and myself and Pam. So we've got a blog team, and Lily is involved as well. We got 4 people, and we're creating content that we think is going to be really insightful and helpful to people that are interested in learning more about spine problems and how they're treated, and getting, the real facts, basically. Wow. Is that piece coming out? That's a big piece. Oh yeah. Look at that piece of herniation. That was a good one. That's probably the biggest one of the day. You guys see that?
Yes,
All
we
right.
do.
Now, Henry, I want you to pay attention here.
Copy.
It's very important. Folks, take a look at this. I want this on our website. Let's get some more light on here. All right? More light. Now, what am I showing you? Can you see the pink color right there?
Yes, we can.
That is inflammatory tissue. Go ahead and get that picture.
Copy that. Alrighty.
You can see the inflammatory tissue right there. That means this thing has been under inflammation. I want this right here in your repository, where you have disc inflammation, your annular inflammation, and disc fragment. Disc fragment with annular inflammation, Disc fragment with inflammation. And that is a beautiful picture right there for our educational content for people. It's the first you'll ever see. Why? Because nobody else in the world pays attention to inflammation on the disc. You understand? Nobody understands the significance. So they're not going to show you pictures of it. They're not going to talk about it. We're the first to really explain it and understand the value and the importance of that inflammation. That's why we do the Deuk laser disc repair, to get rid of the inflammation. All right, we're just about done. I've got about 2 minutes left on this disc. There's not much disc left. Look at that inflammation right there. You see that? That right there. Take a picture of that, Henry.
Copy that.
That inflammation happening in the annulus there is getting on the herniation that we just took out, and that's why the herniation had it. It's literally growing on it. Okay, I've been watching a program called Stranger Things.
Correct. Stranger Things.
Stranger Things. And this TV series, which is very famous in the United States, probably the rest of the world, it's my second time watching it. I just started watching it a few days ago, second time. And it's about this, it's another dimension. I won't go into a lot of detail, but there's this mold growing, and it's like a fungus growing from another world. And there's lots of movies about fungus from another world, like mold spores from another world. But if it gets on you, then it can contaminate you, and you turn into a monster. All right? And that's not from this movie, but it's from another movie that I watched where they were in Russia, and there was a deep bore, the deepest bore, and it went down to what they call hell. And basically this mold spores came out and infected humans and turned them into these crazy monsters, right? So my point is, this inflammation is like those mold spores. If it gets on the herniation, it turns it pink, and it creates all this pain and suffering. So it's like straight out of a horror movie. Maybe someday I'll direct a horror movie called Annulitis.
It's a good title.
You like that? Annulitis. The terror within. The monster living in your back. All right. You can tell that I'm an 80s child. Just about done. Any questions?
At this moment, no current questions. We're all caught up to speed.
All right, Henry. Well, we're done. I'm going to just be done in a minute. So why don't we wrap this surgery up and bring everybody back in a few minutes for the bilateral piriformis muscle release.
Copy that.